You know, it is still afternoon, but it is 2008, so I just want to wish you all a very, very, very happy new year. It's, you know, I visited family over the holidays, and, you know, it's just so exciting to have special people in your life, and I can tell sitting when I was talking to each one of y'all at each different table, there's different people there that are special in your life. So that's kind of what this is going to be about, is you and the other people in your life as it relates to diabetes. As Julie said, my name is Paula Kreissler, and I am the owner, I'm the president of the Wound Care Clinic, and we're a standalone clinic we've been open not quite 3 years. April of 2005, we opened up a single clinic in Savannah, and we're right between both hospitals, Memorial and Candler, on 68th Street. But then we got so busy that this past July up in Pooler, we opened up a second clinic, and it's been doing really well. And so everybody keeps saying, well, where's the third one going to be? And as Julie said, and I've said this before I ever planned to come here tonight, but Richmond Hill definitely has a clear opportunity to be the third location, because I truly believe that everyone out here in what I consider the country you know, you want your health care here. You don't want to have to travel to Savannah to get it unless you have to. So that's my goal, is to be able to, with the Wound Care Clinic and of course with American Diabetes Association. So let me go into that just a minute too. My role there with American Diabetes Association is I'm a volunteer, and I chair the Leadership Council, and I talk to a lot of different groups in this role about diabetes, and they can be school age, it just runs the whole gamut, but every audience of course is different. The topic that we decided on for tonight is the 5 hidden signs of diabetes in the elderly. I'm just going to kind of underscore that with some statistics that I have. 21 million Americans have diabetes. Every 21 seconds in America, someone is diagnosed with diabetes. Every minute, 20 people undergo kidney dialysis due to diabetes. Every hour, 9 people undergo an amputation of a toe, foot, or lower leg because of diabetes. And every day, 66 people, 66, go blind. And every year, over 200,000 people will die due to complications from diabetes. And one of probably the most startling facts right now is that for every child born after the year 2000, 1 in every 3 of them will develop diabetes in their lifetime, unless we do something. Global warming is a big thing in the news right now, of course, and it should be, and diabetes should be the same way, and we can actually affect that if we do things differently now. So I'm going to ask each of you to understand what we can do, and it's pretty simple actually in the big picture of things, to be able to affect that number, to make it go down, because we would all like to see that happen. Okay, what is diabetes? It's a disease in which the body does not produce or properly use insulin. Insulin is a hormone that is needed to convert sugar into energy needed for daily life. And the cause of diabetes continues to be a mystery, although both genetics and the environment factors such as diet and lack of exercise appear to play roles. And I'm going to tell you a little more about that in a minute. Just last Friday, it was almost a week ago, I was in Claxton at a health fair, and there was a gentleman, he was actually about my age, I'm 55, and he was fit, tanned, looked good, looked healthy, and he said that he just in the last 2 months had a diagnosis of diabetes. He hadn't been overweight, he exercises, but he was diagnosed with diabetes. So it can happen to anybody, anytime. Now, here's the first, so the 5 hidden signs of diabetes in the elderly. I'm just gonna, and I'll repeat these a couple different times during the evening here. recurring or hard to heal skin or gum infections. So if your skin is hard healing, then there is a possibility that you might have prediabetes. A recurring bladder infection. If you're drowsy, have drowsiness or fatigue. If your vision gets blurred, if you have blurred vision, but then, and it comes and goes, not just kind of a constant, like, you know, like I need my reading glasses, I know my vision's going, but if it comes and goes, then that's a sign. And the last one is tingling or numbness in hands or feet. And that's called diabetic neuropathy, and you may be diagnosed with that. I see a head shaking. So, and I'll just say that those are the typical folks that I see in the wound care clinic. People that don't know that they do know they're diabetic, but what happens is they'll step on something and they won't know it because they can't feel it, and then it turns into just a horrible, horrible wound. And one of the things that can happen, as I talked about earlier, is you can get an amputation. And that's what we at the Wound Care Clinic want to avoid. So I'm going to give you information that can keep that from happening, and for your loved ones too. So that's the most important thing too. So you all are eating healthy. Those egg sandwiches are perfect. I see a lot of people drinking water. That's awesome. And so eating well and diet, we're going to talk a little more about that. Not that you haven't heard enough about diet and exercise, I'm sure, on a lot of different occasions. But on these 5 symptoms, recurring or hard to heal skin or gum infections, recurring bladder infections, drowsiness and fatigue, blurred vision, or tingling or numbness in the hands or feet. Those are the 5 things that you just wouldn't think. I mean, no one would just think those. That might be something relative to diabetes. Also out on the table, and I'll talk about most of this later, but on this one corner, it's 7 simple questions. It's a risk test that says maybe I'm at risk for diabetes. And but the first thing that I'm going to run down this list, if you're over 45, which I am, and I'm going to guess that most of you in this room are, maybe, I don't know. I'll find somebody that might not be. Anyway, if you're overweight, but actually all of y'all look like you're in great shape, which is awesome. If you have high blood pressure and you have a family history of diabetes, you're at great risk for developing diabetes. So if you're thinking about yourself, do that. But if you're thinking about some of the people that you love, your children, your grandchildren, your great-grandchildren, those are some symptoms that are some indicators that might indicate that they may have a predisposition for diabetes. Unfortunately, most people first become aware that they have diabetes when they develop one of the serious and life-threatening complications: heart disease, high blood pressure, blindness, kidney disease, or they have an amputation, which is just, that's what we help keep out of someone's life.